Welcome, everybody. Thank you so much for being here. This is really a special event for us all at the CHC, and so I'm thrilled to welcome everybody to the third annual Nancy Adler Endowed Lecture. For those that don't know me, my name is Eric Prather. I'm the director for the Center for Health and Community, the CHC that Nancy founded over 25 years ago. And honestly, I can't believe it's been a year since we had this event to share this space together. But, you know, I think we can all say for many of us, it also feels like the longest year we've ever had. But today is going to be a day of celebration, of remembrance, and inspiration as we're treated to a lecture from Dr. Michael Drake, who is near and dear to UCSF, a close friend to Nancy and her family, and the most recent president of the University of California. Before we get to that, though, I do want to do some housekeeping things. So for those of you that are not familiar with this building, the bathrooms are through the lobby by the elevators on the right. And we're also going to have a reception on the fourth floor terrace when this concludes. And I really welcome all of you to attend that, so that we can kind of spend some time in community, sharing some time together. And then I really want to thank all the people that played such an important role in executing this really important and special event for us. So I want to thank Dina Frage and Cherie Rivera and Lucy Coe for all their part. Thank you guys. I want to thank Jennifer Taggart, who is the new executive director for the CHC. And then, of course, I want to thank the Adler-Milsing family for coming, for all of the friends of the CHC, those of you that have contributed financially and otherwise, and to all the people that have come in person, and the many, almost 100 people that registered on Zoom to take in this event. So we're really excited for it to unfold. And so, but first, I want to have a few remarks about Nancy, so kind of set the stage for why this is so important to us. I was really fortunate to first meet Nancy when she was on the external advisory board for the Pittsburgh Mind Body Center when I was a graduate student at the University of Pittsburgh. She came with several other faculty to kind of make sure the center was doing a good job. I was incredibly excited, but was ultimately, I didn't meet her because I was too intimidated. Like I couldn't bring myself to go up and say, "Hi, I'm Eric." And so I didn't. I just kind of hung out on the edges. And that was because she was a legend. The work she has done, that she did steering the MacArthur Foundation research network on socioeconomic status and health, was transformational for me and my peers at that time. We were obsessed with trying to understand how the social world got under the skin to affect health. And it was through that network that really laid the groundwork for decades of research to come and launched the careers of countless scholars dedicated to the social determinants of health in that space. Nancy's ability to inspire through scholarship touched so many. This was true of her essential committee work that she did for the National Academy of Medicine, including the work integrating the social and behavioral factors into the electronic health record. Now, it seems so obvious now, but at the time, it was something that wasn't included. It was something that maybe wasn't thought to be necessary. But that program, those measures are there now, and it has led to the expansion and elaboration by other programs like Siren, where they are taking this work forward, and that's co-directed by Laura Gottlieb, one of Nancy's mentees. I was incredibly fortunate to come to UCSF to work with Dr. Alyssa Eppel, one of Nancy's mentees. She had many mentees through the Robert Wood Johnson Foundation Health and Society Scholars Program, of which, not surprisingly, Nancy directed the UCSF site because she directed lots of things. And for nearly 10 years, I worked side by side with her studying her greatness, like trying to understand, like, what is it that allows her to, move through the world with such gravitas? It was really incredible. So many of us have stories about how she's able to run a meeting, right? Like she sits really quietly, analyzes all the information, takes in everybody's side, and then has this like mic drop moment where she's just like, and this is how it is, providing kind of an important and critical flaw in their argument, or giving out a piece of wisdom that actually moves the whole program forward. And we saw that time and time again. She had this ability to think so logically, so carefully, to edit your paper or your project with such dexterity, replete with an unthinkable amount of red ink. But it ultimately made it so much better. But for all of these memories, what stands out to me most was her open office door. So when we were at Laurel Heights, that's where the health psychology program was. That's where the Robert Wood Johnson program was. And her office was in the corner. She had this like beautiful office. I mean, like looked out. It was kind of, you aspire to have such an office, but of course she absolutely deserved it. And I would kind of wander around just looking for people to talk to. Me, like I kind of like people. And so, her office door would always be open, and she would always invite me in. She would always invite me in and say, take a seat. And we would talk about research. We would talk about how to make the center better, how to kind of create more interdisciplinary programs. But we also kind of talked about life. We talked about kind of the things that are outside of the UCSF institution. She loved to talk about her grandchildren. Her eldest granddaughter, Gabby, is the exact same age as my son, Spencer. And so it was this really special time to kind of talk about their development, our hopes, our things that we feared. And it was this opportunity to see this bridge beyond kind of the incredible work that she's done on the research enterprise to like what it means to have a full life. Nancy had this incredible capacity for mentorship, making her mentees feel like they belong, but that they could also be better. And it wasn't because we weren't good enough. It was because there was more work to do. She spent her career making sure those of us devoted to reducing health disparities and expanding our scope beyond the genetic code had a seat at the table. Nancy had a vision to elevate social scientists in medical school campuses, including pioneering work at UCSF, and took on leadership roles nationally to help establish the field of population health. Sadly, we are in a time where some of those seats are being diminished, and in other cases, being taken away completely. In the current climate, I often wonder what Nancy would say or do. Nancy was patient and shrewd, strategic and skillful in how she navigated academic institutions and spaces of power. She witnessed a great deal of change over the course of her career. She had an unwavering commitment to scientific rigor as a basis of any argument. But I think she would also agree that rigorous data not put to good use is neither good or useful. We have more work to do. We will do it together. The CHC will do this work. Nancy will remain our North Star. And I think we will also hear about what this work looks like from our esteemed lecturer today, esteemed speaker. And I'm so grateful for the opportunity that I had to learn so much from Nancy and to celebrate her legacy today. And so to move things along, I want to welcome up Dr. Matt State, who is the Obendorf Family Distinguished Professor and Chair of Psychiatry and Behavioral Sciences, for a few remarks.
Good morning, everyone. Delighted to see you here. Welcome to the UCSF Department of Psychiatry and Behavioral Sciences and the Nancy from Pritzker Psychiatry Building. I'm Matt State. I am, as you heard, the chair of the Department of Psychiatry and Behavioral Sciences. It is my honor to welcome you to this annual celebration of the remarkable legacy of our former faculty member, leader, mentor, and friend, Dr. Nancy Adler. We're delighted to have Nancy's family here with us today, and so pleased that President Emeritus Drake has agreed to give the lecture. It makes this a particularly special occasion for us. This celebration, as you know, honors Nancy's memory and her extraordinary contributions as a mentor and a researcher, as a national leader in health psychology and medicine. No one had more of an influential role in advancing the idea that to fulfill its highest aspirations, contemporary medicine had to address the behavioral, environmental, social, and cultural aspects of health and healthcare delivery. And I can't think of a more important or meaningful moment for all of us to gather together to celebrate her tireless efforts in this regard, all of which inherently champion diversity, equity, inclusion, and opportunity. Her legacy lives on across the country, across the globe, here at UCSF in many ways, including in the tremendously impactful work at the Center for Health and Community, and perhaps most importantly, in the generations of trainees that she inspired. And along those lines, it is my great pleasure today to be able to announce 2 endowed professorships in our department awarded to faculty who were among Nancy's most stellar proteges and who are carrying on her legacy and her mission in their work and in their leadership of the CHC day in and day out. So first, I am pleased to announce that Dr. Eric Prather has been appointed as the Pritzker Family Fund Professor in Health and Community. This chair was established in 2008 by Lisa Stone Pritzker and John Pritzker to support the director of the CHC in perpetuity. I think, as you all know, Dr. Prather is a clinical and health psychologist whose research focuses on the causes and consequences of insufficient sleep and ways to leverage sleep to improve health and well-being. He was named associate director of the CHC in 2014, became the interim director in 2022, and subsequently was appointed as Nancy's successor permanently in 2024. The awarding of this chair is in recognition of his outstanding leadership of the center, his many contributions to the university and to the department, and his world-class scholarship. Congratulations, Eric. I'm also thrilled to announce that Dr. Alyssa Eppel has been appointed as the Sarlo Ekman Professor in the Study of Human Emotion. Congratulations, Alyssa. This chair was established in 2006 by the Sarlo Foundation in honor of Dr. Paul Ekman, Emeritus Professor of Psychiatry at UCSF, and the world's leading expert in facial expressions, emotions, and the detection of deception. Dr. Eppel is an international leader in emotional well-being and resilience. She is professor, director of the Aging, Metabolism, and Emotion Center and the Consortium for Obesity Assessment, Study, and Treatment called COAST. She has just completed 2 phenomenally successful terms as vice chair for psychology in our department, and she has now accepted a newly established and extremely timely role as special advisor to the chair for well-being and resiliency. Thank you, Alyssa, and congratulations. I also want to extend my profound gratitude to the Pritzker, Sarlo, and Ekman families for their generosity in establishing these professorships and their commitment to the long-term success, both of the department and, importantly, the Center for Health and Community. I also want to give a special welcome. Where's the camera? I don't know. But a special welcome to Lisa Stone Pritzker and to Paul and Eve Ekman, who were unable to join us today in person, but are watching us today on Zoom. Hello to Lisa, Paul, and Eve, and thank you so much for all of your tremendous support. I'd also like to take this opportunity to thank all the donors, foundations, and individuals, and the representatives in the audience today who have supported the CHC over many years. Your philanthropy has sustained the center and helped keep Nancy's vision and work alive and thriving. So now it is my honor to introduce our Chancellor, Sam Hawgood. I get to say a few words about this. Over the past 11 years, and especially in the last 5 with the pandemic and all of the challenges that have confronted UCSF, academic medicine, and academic freedom, UCSF has been reminded daily just how much leadership matters. And there is no department that experiences this more acutely than psychiatry. And I think all one needs to do is to look around you in this room or to look in the atrium as you walked into this gorgeous building, how much we have benefited from Sam's mission-driven and visionary leadership. I know that Lisa Stone and John Pritzker share my belief that this building, but more importantly, all that it reflects about the respect UCSF accords our field of medicine, our science, our patients, and their families would not have become a reality without Sam. He is the 10th chancellor of UCSF, appointed in 2014. He's been at UCSF for 40 years with a career spanning all missions of the university. He's the Arthur and Tony Remby-Rock Distinguished Professor. As chancellor, he oversees a multi-billion-dollar UCSF enterprise, which includes the top public recipient of research funds from the National Institutes of Health, a nationally ranked medical center, San Francisco's second largest employer of more than 40,000 faculty and staff. And I have to add, the leader of the most consequential clinical and basic behavioral and neuroscience community in the nation. So thank you, Chancellor Hallgood, for joining us today.
Matt, for those overly generous remarks, but it's always a pleasure to visit this wonderful building and to speak at now my third Nancy Adler lectureship. Today, I have the great honor of introducing a colleague and friend, Dr. Michael V. Drake, to be our lecturer this year. Michael is unquestionably a visionary leader, esteemed educator, dedicated physician, whose extraordinary career has left an indelible mark on higher education, academic medicine, and society at large. Michael currently serves as a distinguished professor of ophthalmology right here at UCSF, a nice closing of the circle, bridging his decades of experience, wisdom, and commitment to equity and excellence to our institution. But of course, his impact reaches far beyond UCSF, as his leadership has shaped some of the most significant institutions in the United States. Most recently, Michael was the 21st president of the University of California, which means he was my boss for 5 years, where he oversaw one of the most prestigious public university systems in the world. A system, as you know, that includes 10 campuses, 6 academic health centers, and 3 national laboratories. As president, and I was able to witness this firsthand, he championed UC's mission of academic excellence, innovation, and accessibility, ensuring that students from all walks of life could benefit from the transformative power of higher education. His tenure marked a time of continued growth and progress for the UC system, reinforcing its role as a global leader in research, education, and social impact. Now, prior to his time as the UC president, he served as president of, and I've been taught this, the Ohio State University, where he guided the university through remarkable growth and transformation as well. Prior to that, he was chancellor of UC Irvine, where he also led major advancements in research, diversity, and community impact. Earlier in his career, he held leadership roles right here at UCSF, including holding the Stephen P. Shearing Professor of Ophthalmology, and he was Senior Associate Dean in our medical school. Beyond his formal leadership in higher education, Dr. Drake's influence has extended to cultural and creative realms. Some of you may not know that as a lifelong admirer of music and the arts, he served as a board member of the Rock and Roll Hall of Fame. And I'm sure if he had his guitar here, he would play you a song. This unique connection reflects the breadth of his interests and his ability to bring the worlds of education, medicine, and culture together. He has had numerous leadership roles in higher education and academic medicine, including leadership of such organizations as the Association of American Universities, the Association of Public and Land-Grant Universities, the NCAA, and the Association of Academic Health Centers. At every step, his focus on equity, accessibility, and the transformative power of education has set him apart. His dedication to advancing social justice through medical education has earned him numerous accolades, including the Herbert W. Nickens Award from the Association of American Medical Colleges. These are values that resonate deeply with us here at UCSF, and they remind us of the profound impact education and medicine can have in creating a more equitable and compassionate world. He is also a fine scholar, co-authoring 5 textbooks. He holds 5 honorary degrees and is an elected member of the National Academy of Medicine and the American Academy of Arts and Sciences. It's with enormous pride that we welcome Michael back to faculty here at UCSF after such a transformative career. So please join me in welcoming him to the podium.
Well, thank you very much, Sam, for those kind remarks. I appreciate it. Very nice to see all of you and to be here. You know, my association with UCSF began really when my brother was a psychiatric resident in the late 1960s, and his being a resident was an unusual thing for us. The places like this were not in the realm of possibility as we grew up. And he was a very outstanding student and was able to do things that people before him hadn't done. And coming to UCSF was a part of that. So I learned of UCSF as a high school student and learned to admire it very much. So great to be back here. And I want to echo, Sam, your leadership of the campus during these last 11 years has been terrific. And the ups and downs, but the incredibly soaring ups are something that we see and is reflected here and really across the region and influence that extends across the world. So thank you again for doing that. It makes all the difference. Great also to be here with Nancy's family, our old friends who we've known for so long and in so many different ways. Other day school parents as well. It's nice to have a little bit of a reunion there, but great to see you as always and look forward to spending more time with you as we roll forward. And then I'm, of course, particularly honored to be able to speak for a moment in honor of our friend Nancy. Nancy and I met as junior faculty members on the search committee for one of your predecessors. Then this was for Sam Brandes for the chair of psychiatry. So we were on a search committee. My first search committee, I think it was a training ground, and she and I were the kind of boomer generation kids on this committee with all the adults. And it was great fun. Holly Smith was the chair of the committee, and so he was a great person to work with. And Holly also chaired the admissions committee at the time, and I chaired one of the panels. And that next year, I had 4 slots to fill to put people on my panel, and so I picked 4 people. So I added Nancy to the committee. Also, I added Woody Myers and Susan Wall and Jean Washington. And the group of us got a chance to work together then as new faculty members rolling forward. And honestly, we've stayed in touch then for all of the years since. It's been really, really terrific for us. And Nancy also was, one of the things that helped me bond with Nancy, besides being, again, of the same generation, was that she was a new mom at the time. And we just had our second son, Sean, and Sarah was in diapers at the time. And so we were able to have a lot of things to chat about just in the general affairs of the world as we move forward. And it was really a great way to get to know someone. Of course, these things have nothing to do with Nancy, the scientist. And one of my daughters-in-law is a professor of public health, and she refers to Nancy as a hero in her field. Harvey Feinberg, who spoke a couple of years ago on this at this time, said that Nancy was the outstanding social scientist of her generation. I think that that's a reasonable focus and really helps us to understand the quality of the impact that she's had for so many people. I appreciate you said that you couldn't talk to her when you first met her. We've all met people like that, who the first time we saw them, we just didn't really know if we wanted to talk to them. And it took a while, but actually when we did, we found out on the other side of all the accomplishments was a wonderful person. And it's, I appreciate that and knowing that that's true. David Brooks wrote a book 10 years ago, writes lots of books. He wrote a book 10 years ago called The Making of Character. And he described in it two types of virtues. One were resume virtues, the kinds of things that, like Sam just read, the things that you list that are kind of who you are in the world, all the different things you've done, and the things that lead to how much money you make, where you live, all of those kinds of things that build you up as a resume. And we spend lots of time in our lives working on building resumes and getting these resume virtues down. The other type of virtue that he spoke of were something he called eulogy virtues. And those were what kind of a person you were. Not so much what you did, but how you did it. Your kindness, your generosity, your compassion, your friendship. And actually, in the end, those are the things that really matter in the world. And Nancy had a resume that is second to none, really second to none. Again, the leading person in her field in the country. But she also was top rung in the eulogy virtues as a person, and how rare it is to have someone who's really at the top of the ladder in both of those categories. That's a tremendous thing. How lucky we all were to know her. How lucky the world was to have her to help lift this all forward. Now, the title, I pick a title to this talk, and something occurred to me, and it really was given the challenges that we're all facing today, the way that higher education broadly, higher education and health really work together. And so it really is the symbiotic relationship between higher education and public health. How I started thinking about the symbiotic relationships, and I want to make sure I'm going to push my right. Is that perfect? I'll get to that in just a moment. I mentioned early on that we've known Nancy and the family for a long time. This is a picture from my son Sean's 4th birthday party at Lawrence Hall of Science. We tried to scaffold him early, and I'll just click one there, and a little. That's Julia there. So I said Julia. It was Sarah, and I transposed. We know Sarah and Julia Collins. And you have the opposite ages. So I it's Sarah. But anyway, just wanted to give real evidence of the fact that we've known you for all of these years. Symbiotic relationship. So one more. This is a ride on the steam train. Our daughter-in-law, and sitting in back then holding the camera was where I was, and then on my lap was our 6-year-old at the time granddaughter. And when we got on the train, it was July. This is in Tilden Park in Berkeley, so it was July, so it was cold, normal. And she was sitting down low, and I said, "Oh, here, hon, sit on my lap, and then you'll be able to see better, and you'll keep me warm." And she said, "Oh, Grandpa, a symbiotic relationship." And I said, "Perfect." And I will say, forgive me for showing home movies, but if any of you haven't been on the steam train, whatever you're doing instead of that, the steam train's better. It's a wonderful thing right here in our midst, and it's just a great way to spend 10 minutes and kind of be in touch with the world and the redwoods and everything else. So symbiotic relationships are really, really important to us all. So mutualistic symbiosis, when two or more species are interacting over time to the benefit of both. Straightforward, again, something that you all know so well. And when we think about higher education and health, there are a couple of ways that health is benefited by education. One is the sort of fundamental cause theory, which says that education is fundamental to health because it determines access to multiple things that help you be healthier, like a safe neighborhood, a good job, ready, available healthcare. So an educated person has a better way of taking care of their health, more facilities to do that. Another theory is the human capital theory, which says that education is an investment that improves your judgment, your knowledge, your skill, your ability to make the right kind of decisions, like a decision to stop smoking or whatever else. You're elevated to have a better diet, to get better sleep. You learn how to do things that help allow you to be healthier. And then the third would be the signaling and credentialing of education. Having a degree tells the world that you have certain skills and abilities, and that enables you to access those kinds of things that make your life work better, again, like a better job. And some factor of all of them, I think, helps to explain why there's such a powerful impact of education on health. There are multiple examples of how higher education and health support each other. And again, everyone here knows this so well. But a couple things that I found just interesting. Over the past 20 years or so, college graduates have an increase of 2.5 years of lifespan. And this would mean that college graduates in this country were a country of their own. They'd be number 4 in the world in lifespan. If you look at people who who haven't completed high school, then their lifespan has stayed flat over these last 20 years, and they would rank 137th in the world if they were a country on their own. The difference in the lifespan between them, 84 to 73 years, is 11 years. And I remember first seeing the fact that there was an impact of years of college or years of education on lifespan about 40 years or so ago. And there the impact was about 4 years plus. And I thought about how interesting that is. The time you spend in college kind of gets paid back to you by living that much longer. It's kind of a freebie, right? It's a freebie. And then thinking about physics in the world and how things, you can't get something for nothing. As I watched over the years, that 4 years became 5 and 6 and 7 years. And actually the time you spent extended your life even beyond that. To now the point now in the early 2020s, it's 11 years difference in expected life expectancy for people who don't complete high school compared to those who complete college. So it really is, really shows up in profound ways. There are many charts. There are papers stacked high on explaining this, but this is one that I will point out just for a moment. Great. So this is a log regression of mortality. So higher up on the y-axis is bad. That's more mortality. Down low is good. My laser seems to be not quite intense enough. So let me do this. Let me try and point. And so these are different categories of people. So we start with men between 25 and 64, men over 65, then below that, women 25, 64, women over 65. The left-hand side, as you look at the screen, are non-Hispanic white, right-hand side non-Hispanic black. Bottom line, and then more education is along the bottom, along the X, and more mortality is along the Y. So as you go to more education, you have less mortality. So that's straightforward there. Let me go to just a little blown-up vision or picture of one here. And they used as this on the log scale, high school graduation was the 0 point. This is what things are being compared to. And so there the dot is a little bit larger. So that's 12 years of education. And then if you go to 16 years of education, that's the next large dot, right? A little bit further on to the right. And what you can see here is if you look, more years of education help you as you go from 0 to 11. But there's a pretty big increase. The slope really steepens as you go from 11 to 12, and it continues in a relatively steep slope as you go further. And this is the case for all of the groups. That was, I think, non-Hispanic males. This is non-Hispanic white females. Whopping big slope change between 11 years, which is non-graduating from high school, and the 12 years, which is high school graduation. Same thing for non-Hispanic black women as well. Whopping big change between not graduating high school and graduating high school, and then a big change as you move forward. So just straightforward, more education helps, and particularly getting a credential makes a big difference in things that go forward. This is another slide representing the same thing from a different set of parameters. This is in diabetic patients. And again, it's looking at all-cause mortality. Here we have 3 groups. We have less than a high school degree, a high school degree, and more than a high school degree. And again, more mortality with less education across the board. Another illustration of this, and I mentioned this, how this was changing over time. And if we just look at the right, the bar graphs on the right, we have the multiple cause of death data. We have high school or less is on the right, and college or more is, I'm sorry, I want to make sure I'm doing left, right. High school or left is on the, high school more or less is on the left, and college, some colleges on the right. And again, you see the differential. We look on the right-hand side of the slide, the differential in 1990 between high school and college, and the same differential on the other side. And this is not years of life. This is starting at age 25, how many additional years you can expect in this circumstance. So same thing, more education, more additional years of life. Looking more recently and looking at something that's more in the acute rather than over the lifespan, looking at COVID mortality. If we look back at the COVID crisis that we suffered through just recently, we see at the beginning, this is starting in March of 2020, so right when the first COVID cases happened, and this is moving across about a year, a little more. And what you see is at the beginning, the mortalities are relatively, this is excess, I should say, this is for excess mortality. And so you find that the excess mortality for all the groups is nil. It's about, mortality for each group is about what it should be. But the little graphs are no high school degree and no GED, a high school degree or a GED, some college or an associate degree, a bachelor's degree, and graduate or professional degree. And particularly looking at the surge that happened early in 2021, you can see that the impact of the epidemic was incredibly more powerful. 3 times, 4 times, 5 times more deadly, simply if you did not have the education that fellow members of your community did. This was international data. We have data here, important data for me. These are UC, University of California data. And so here we're starting again in March of 2020, and this goes through to the end of 2021. And we see, if we look at UC employees, we have 250,000 employees. And if we compare those 250,000 employees with employed Californians, same age, and look at the excess mortality that happened during that time, excess or compared to predicted mortality. We see at the very beginning in 2020, in March of 2020, the numbers are right about the same. There's not much of a difference at all. We're a little more educated. As you go through the first surge of that spring, you see, gosh, a mortality bump really hitting particularly those people who were not UC employees, UC relatively flat. Going through the summer, pretty flat. And then we had the spike again in January of 2021. And you see that was a dramatic spike for employed Californians. We had a bump at the university, but not all that much. If we go then to the March of 2021, by that time, we had a vaccine mandate. We had social distancing, mask wearing mandates. We got criticism for the vaccine mandate. I got sued for the vaccine mandate. But my goodness gracious, if you look at the time, from the time that the vaccines came on board, the time we had our mandate, straight across for the next year and a half, we had no excess mortality. Well, you may say that's true applause. Honestly, it's a real thing. The area between the curves is the effect of policy and behavior. It's what we expected. It's why we did it. We looked at the end to see if it really worked like we said it should, and it was dramatic for us. So this shows that this is policy, but also an educated workforce, and again, people able to follow on with policy. So 10, 15 years ago, I was at Irvine, as Sam mentioned, and there was a group of philanthropists who traveled around going to different places to visit. They took a bus, they had their spouses, they'd tell you they were going to come by. They were big time philanthropists. I understate that. And so we were very nice to them when they came by, and great to meet them. And so who this group, the group was led by Bill Gates and Warren Buffett, Charlie Munger. And so they would travel around and go and say, we're interested in something. And they were interested in our stem cell research center, and they came by and we spent an afternoon with them. And just in a little, it was a small group, and we were a small group. In a little pod, I was talking to Bill Gates, who I didn't know before that. And I probably would have had a hard time knocking on the door, but it was great chatting. And some of those things you say, as a chancellor, a lot I was saying, that it's really important to invest in. Really pleased about the things you're doing, investing in trying to make people healthier. If you want to make a community healthy, I've always said if you have $1 million, you should build a clinic, and that really will help to raise the quality of health in that community. But if you have $1, you should buy a girl a book. And I thought that was clever, and people generally agreed with it. And I don't know how many of you know Bill Gates. He frowned a little bit and said, "No, that's not quite it." And I thought, "Oh, okay." And he said, the most important thing for you to do if you're going to try to raise the quality of health of a community is to improve the ability of women to control their reproductive health and their reproductive lives." And of course, it goes. It follows on that women who are able to stay in school longer, can do a better job of taking care of themselves, space their children more appropriately, can do a better job of taking care of their children. They can have jobs, they can provide for themselves, et cetera, et cetera. And so the presence of education or educational opportunities in a community don't really matter if you don't have the ability to access them. And for so many women in developing parts of the world, there's no ability to access these things from the beginning. So he said, at the very beginning, you have to do what you can to focus on reproductive health in women. And then you can think about the education system and other things. And so I appreciated that. So the adage was, if you have $1 million, you build a clinic. If you have $1, you buy a girl a book. If you have $1 billion, you change the policies of the country to affect the way that women are able to protect their reproductive lives. And so it was a fun thing. And let me say, just for the Gates Foundation, for Bill Gates, right around that time, the Gates Foundation funded the Family Planning 2020 initiative. That's been great, hundreds of millions of dollars funding that. And then announced just a couple of months ago, they're spending an additional $2.5 billion between now and 2030 on maternal immunization, maternal health and nutrition, et cetera, really doing what they can to lift the quality of health of the lives of women broadly, and particularly in the developing world, and knowing the secondary and tertiary effects that will have. So the bottom line, countless studies around the world highlighting the strong association between education and health. More is better for both. Thinking about education, and education matters, the context of education matters a lot. We found 50, 60, 70 years ago that students who were educated in integrated classrooms had stable or improved educational outcomes, and also they learned valuable social skills as well. This is a picture taken in the backyard 100 years or so ago of the place where I began grade school. I started at grade school in New Jersey about a year after Brown versus Board of Education. My neighborhood was strictly segregated. The school was 100% segregated. And the school now has been torn down. When they tore it down, they took the bricks and kind of put pictures of kids from the school on the bricks like one does. And the pictures, I found this online, actually looking back at the pictures of the kids on the bricks look like I would have looked all those years ago, and like everyone in my class would have looked all those years ago. So we really were segregated. Starting though, I started just after Brown versus Board of Education. So integration started just after that. And what we found was that the law really applied to the South, where schools were segregated by law, and but the practice was extended really throughout our country. And by 1965, 10 years after Brown, I would have asked a question, how many Black students were attending integrated schools in the South? I'll just give you the answers, less than 1%. So the law changed, but the behavior didn't change at all. So something had to happen to make the law change. Now, when we went a little later on, another generation or so, by 1988, more than 50% of Black students in the South were attending integrated schools. And that meant non-majority minority. And so there was a real change between the mid-60s and the late 80s. What's happened, though, since the late 80s is that schools have started to become now more segregated again. There was a peak of integration then, and then we've become more increasingly segregated. And we're actually now approaching levels that were seen in the late 1960s. If you look now, about 83% of Black and 82% of Latino students attend majority and minority schools, and many of these are in high poverty areas. Many of these are low resource schools. The reciprocal is also true, and that's that about 75% of white students attend predominantly white institutions. So there was a change in the amount of integration up until the 80s, late 80s, and now it's going back in another direction. And that happened in schools. There are other places where society has stayed sort of segregated as well. And one of them that's really interesting is Congress. And again, I don't have my laser. If I was an ophthalmologist, if I use a laser, I have to charge you, you know, but that's kind of cute for me. That's a joke I used back then, and it still worked. I'm kind of amazed by that. That's okay, from the old life. But the Congress in so this is the percentage of members of Congress who are white or not white. And the percentage who were not white in 1950 was, I think, 1, but it's very, very low. And that was all the way through each of those dots there across the top is a decade. So across the top line there, very few non-white members of Congress for years. The second decade there is the decade of the 1960s when a lot of civil rights legislation came forward. And if I go here and let me see if I want to make sure I can do this. I wanted to play a video, and let me see if I can do it. I'll click and see if we get to happen. Great. This is a video of Lyndon Johnson.
No constitutional issue here. The command of the Constitution is plain.
And I'm going to pause for a second and set it up. So this is middle of March 1965. I came across this clip last spring when I was going to be talking on the 60th anniversary of the speech. The speech happened March 15th. March 7th was the march across the Edmund Pettus Bridge, so-called Bloody Sunday, a march for voting rights where many people, John Lewis and others, were attacked and beaten. This was now a week later with Lyndon Johnson speaking before a joint session of Congress. It's about a 5-minute clip out of an hour speech. I'm going to try to get
there is no moral
and then talk about it at the end.
It is wrong, deadly wrong, to deny any of your fellow Americans the right to vote in this country.
I'm going to try and skip a little bit ahead for you if I can. If I can't skip ahead, you're going to...
There's no constitutional issue here.
It's a 4-minute.
The command of the Constitution is plain. There is no moral issue. It is wrong, deadly wrong, to deny any of your fellow Americans the right to vote in this country. There is no issue of states' rights or national rights. There is only the struggle for human rights. I have not the slightest doubt what will be your answer. But the last time a president sent a civil rights bill to the Congress, it contained a provision to protect voting rights in federal elections. That civil rights bill was passed after 8 long months of debate. And when that bill came to my desk from the Congress for my signature, the heart of the voting provision had been eliminated. This time, on this issue, there must be no delay or no hesitation or no compromise with our purpose.
I'm going to try to skip ahead just a bit.
We cannot, we must not
Another minute.
refuse to protect the right of every American to vote in every election that he may desire to participate in. And we ought not, and we cannot, and we must not wait another 8 months before we get a bill. We have already waited 100 years and more, and the time for waiting is gone. So I ask you to join me in working long hours, nights, and weekends if necessary, to pass this bill. And I don't make that request lightly. Far from the window where I sit with the problems of our country, I recognize that from outside this chamber is the outraged conscience of a nation, the grave concern of many nations, and the harsh judgment of history on our acts. But even if we pass this bill, the battle will not be over. What happened in Selma is part of a far larger movement which reaches into every section and state of America. It is the effort of American Negroes to secure for themselves the full blessings of American life. Their cause must be our cause too. Because it's not just Negroes, but really it's all of us who must overcome the crippling legacy of bigotry and injustice. And we shall overcome.
So I saw there's a little, about a minute I would have had to skip by just for time, but I appreciate it. And again, it was an hour-long speech. This was the end. And I said, I saw this speech, and maybe I saw it on TV, but when I said to someone I saw the speech, I mean, I actually saw the speech. I was at the National Archives and taken to the back, and we were shown a few extra documents that weren't for circulation. The Bill of Rights written and in hand, it was by hand, but also that speech written. And what I remember when seeing is that the speech was typed, but that parts of it were written in pencil. Things were emphasized in pencil. And the arrow here, there, and then particularly at the very end, where he said, "We shall overcome." The "shall" was underlined in pencil as "we must, we will." And this was a big statement for a Southern American to make in such an audience. And this led to the Voting Rights Act that was passed about 3 months later and changed the complexion of Congress and the course of history and lots of things that changed since that time. So I use this as an example of just the world that we live in is created by us being active, by us doing things, and the things that we do today make a difference with the world that we live in tomorrow. Congress changed a bit as those years as we go forward, and we see now and particularly there's the 2018 midterms. There was a big change in the slope. Congress continuing to change. I think as Congress comes closer to reflecting the body of the American people, we have different policies that come forward. Well, let me wind up by talking about what we do now. How do we go forward now? We certainly know that education and health are connected. We certainly see and feel that our systems are under attack. We have to try to imagine what we might do as we're moving forward. One of our alums, how many people recognize this person? I'm just curious about this. It was great. I was talking to my assistant who's of a younger generation who didn't know of this particular person. So this is Arthur Ashe, who's a UCLA alum and was during the late 1970s, #1 rated tennis player in the world, had a great career as an author and philanthropist, cut short by contaminated blood transfusion during bypass surgery. As a young man in his 40s, became HIV positive and died. So it was a very sad time in the 1990s before we had effective treatments. Arthur Ashe, in one of his books, or in part of his speaking, had a statement. He said, if you're having a difficult time, you start where you are, you use what you have, and you do what you can. Start where you are, use what you have, and do what you can. I think for all of us here at UCSF and at similar institutions, there's a lot that we can do. We can approach things with open hearts and open minds and try and take the world in. We can lean into the world that we see around us. I still believe, I'm optimistic. I was raised in the boomer generation. We were taught that the arc of history would bend towards social justice, and we saw that happening in our lives. That was great. I still believe that is true, but I now understand that it doesn't necessarily bend itself. We have to be leaning into it if it's going to be bent, if we want a more just and healthful world. We've always found a way forward. Sometimes that's been obscure. I read as a teenager Dante's Paradiso, and I remember that one of the things that inspired me about it was that every rung on the ladder that he sort of climbed, he could see more than he imagined before. And you learn more as your lives go forward. I think if we think of our careers broadly, there's what we thought we were going to do. And as we move forward, there were things we didn't know that were there to be done, that we could see and then aspire toward as we continued to move forward. I think that is open and there in front of us, and we have to continue to move forward to it. I think also forward, it's very important to try to be involved in the policy making of the enterprise that you're involved in. And that can be as simple as with the department and working in departmental politics and policies. It can be in the community. It can be on a larger scale. And I think that's very, very important. Yeah, I've spoken about generations today. About things when I was 4 or 5 years old at the very beginning, and talked about some things that were going on at the time that Sarah was 4 or 5 years old, and how we've rolled forward. And now your children are in that same age bracket, and we would continue to move forward. And what we have to do is continue to know that we're part of a continuum, and our efforts now make a difference for today, but also a difference for the future. I think that as teachers, we can be more sensitive to our students, try to do our best to meet them where they are. As researchers, we can think broadly about the things that we study to try to make sure that is broad and we're being inclusive. And as colleagues, we can do our best to be connected to the people that we're working with. All of these things are important, and it's always important also to bring your very best self to your work, to your life, to your family every day. Just do your best to bring your best self there. And I think that the path forward will kind of reveal itself to us as we do that. And maybe a really important additional step is that you can work intentionally in your personal and professional relationships to support family, friends, colleagues, and community. You can do your best to be kind and accepting, to model openness and excitement, to be all in here at work as well as at home. And those things will help you advance UCSF or wherever you're working to make it the best it can be, to make those places that are A+. And importantly, you can work to be on the top rung of the eulogy virtues, as well as having an amazing resume. In short, you can strive to be more like our friend Nancy Adler, to light the world in the fleeting moment that you are with us, to leave the world a much, much better place, to leave the world warm and vibrant in your wake. Thank you all very much. Thank you.
Thank you so much, Dr. Drake. I'm Claire Brindis, and on behalf of the Planning Committee, I'm just so grateful for your illuminating comments. We have an opportunity for some questions and answers. Answers here, questions here, and a mic, I hope, that will be circulated. But I'm going to take the prerogative of doing the first question, which is very much about these times and these challenges, keeping an eye to the future. Are there some lessons from being a leader in transformative times? We see Dr. Hoggard and his leadership qualities, many qualities of leaders throughout our campus and throughout the UC. But from your vantage point, what have been some of the lessons that have been particularly important for you?
The challenges of leadership occur every day. So they're every day. One of my predecessors, I was speaking to give a eulogy for one of my predecessors. This is David Gardner. I'm here. Yeah. David Gardner. And I remember when he stepped down, someone said, "Well, I can see you step down when you did, because my goodness, look at all the things that happened last week. I mean, that would be a reason for stepping down." And he said, "That's every week. There are rough times all the time for us." I think the most important thing is to try to tell the truth all the time, to try to be authentic and present all the time, to try to keep in mind your values, what's important to you and why, and then to make your decisions with those things on the table in front of you. And I think that's really important, even when you don't know that it's important. It's important next year or 10 years or 20 years from now that you'll need something like an acorn that you planted. And if that's an honest, authentic, present acorn, then you can stand on it as you move forward.
Thank you. I'd like to open it up for other questions from the group, not to be shy. Yes. And would you please introduce yourself?
Thank you. Hello, my name is Susanna Martinez. I'm an associate professor here at UCSF in Epi and Biostats, formerly at the UC Office of the President under former President Napolitano. My research focuses on food insecurity in college students. And so my question is, you could give the boy or the girl a book today, and with increasing costs of higher education, increasing cost of living, what recommendations or what advice do you have for a researcher like me who's working to improve food insecurity among college students in order for them to complete their degrees?
Yes, so I'll answer the question and a little broadly. So basic needs are a critical part of being able to be successful in college. Getting to college is one thing. Being able to get through college is another. And I think that we believe that supporting the basic needs of the students is critical for their being able to be successful. A couple of things that we did, not so widely publicized, but we changed the funding formula for undergraduate institutions with our state funding to be based on the resources of the high school the student came from. So if you were in a low resource high school, you get a larger fraction of the distribution of the funding, so that with the concept that the institution will have to do more things to support you on your pathway through. So food insecurity would be part of that, housing insecurity. Other kinds of support are really, really important to us making the whole thing work. We also have a program moving forward, and still hand off, but they'll hope to continue running with it to make it that every student who entered the university by 2030 would have a debt-free pathway to completing their degree. And that there are two ways that we do that. One is by grant funding, by giving money to students to pay for those costs, and that has increased every year, $400 million increase in that pool of money since 2021. So we're increasing that amount of money that goes to low income students, and then lower and lower income students. And then we also are doing our best to provide work opportunities for as many of our students who would like to or who would need to have that way of bringing in extra resources to help them through school. So providing money in the form of grants, providing work opportunities so students have financial resources to support themselves, but also taking basic needs of students as the responsibility of the institution and continuing to power things forward that way.
There seems to be a question from our audience online.
Yeah, we have a question from one of our online viewers. Thank you so much for your important presentation. I'm sure you've been asked this before, but do the studies linking education and mortality control for socioeconomic status and adverse childhood experiences?
Yeah, so there are hundreds of studies, and they've looked at it in all kinds of different ways. So the ones I showed here largely pooled things together. So they'd have hundreds of thousands or millions of people would be the data points. But there are a variety of studies that look at all of those things as well. And they all of the compounding factors tend to modify health in the way that you would expect that they would. So I'd say, yes, there are multiple studies that control for different individual of those parameters. The one, I think that the one of the graphs I showed had 13 different points from which they looked at the success of people, and it tends to play out time after time as we would think that it would.
Yeah, hi, Mike Martin with the Department of Epidemiology and Biostatistics. I'm just wondering what can we do about the disparity between the rich and the poor? It seems like that's behind so many problems we have, and a key factor for the social determinants of health. It's a problem that is getting worse all the time. Are there any solutions you could suggest, or what are your comments on that?
I would say a couple of things. One is that we think a lot about the basic needs, the foundations that people need to be able to be successful. So we have again, using the University of California program, focusing on basic needs and doing what we can, particularly for students from lower resource families, to make it they can get through college, get that degree of certification, and move on into the world, which we know will. I mentioned the positive impact of education on health, or the positive impact of education on health. It also has a similar positive impact on one's ability to have a job that provides resources that allow you to support yourself. And so we think very much that it's important to allow students to get through once they get to us. We also then have a variety of programs that we invest in, and others that are meant to elevate the people to the point that they can, even if not going to college, I don't mean to say that's the only way to go forward, but whatever one's circumstances, can help to support your basic needs. So universal high school education requirements, that was a big social that had to be 100 years ago. People had to decide to do that 120 years ago. That was a decision that had to be made. It made a huge difference in lifting the social status and socioeconomic status of the population. Those things are important. Looking broadly at the developing world, there have been incredibly important programs that we funded as a nation. I think those programs remain incredibly important. We see that philanthropy like the Gates Foundation also is looking at those areas as well, to lift people out of abject poverty and to give them opportunities to educate themselves and to move forward. And all of those efforts together, I think, are helping to particularly lift those who struggle most on that scale.
Thank you so much for this wonderful talk. I wanted to I've been thinking a lot about sort of this conversation happening. I think this being San Francisco, it's sort of a good place to ask this question maybe, but there's a lot of zeitgeist around the rise of artificial intelligence and the sort of ways in which it might obviate, the need for certain kinds of higher education. And I'm wondering if you could sort of give your response to that sort of line of conversation and sort of make the case for higher education in the sort of coming economy and the coming world that we're entering into.
Oh, gosh, yes. So I think AI is transformative and will be transformative in lots of ways. And I think AI is transforming the way that we do education, higher education, and K through 12 education. I have grandchildren, as you saw, and they are using AI in grade school, to kind of help them as they move things forward. As we think about AI and the benefits that it brings to society, I think it still requires a human hand, a human interface in how things are applied and distributed, because one of the things that we see is that where there are advancements and technological advancements in our society broadly, those can help to eliminate disparities between people, or they can magnify those disparities greatly. If we look at higher education, broadly, the educational pathway is a great way to help narrow disparities in achievement and opportunity, but also it's a great way to help accentuate those opportunities. If they're particularly exclusive schools that have people from exclusive backgrounds that get rights to an exclusive pathway forward, I mean, those things tend to widen disparities. And so we have to think quite intentionally about disparities per se, and how any of the progress that we see in the world can help to make those disparities closer, as we saw with grade school education over the 70s and the 80s, or can in fact widen those disparities as we see happening now.
Hi, I'm Laurel Mellon. I'm a health psychologist.
Please introduce yourself.
Oh, I'm sorry.
Go ahead. Go introduce yourself.
I'm Dr. Laurel Mellon. I'm a health psychologist, and after 42 years, I retired from UCSF as in the faculty in family medicine and pediatrics. And I studied stress resilience, particularly emotional stress resilience. And given how much stress we're under now, and that most of us have chronic physiologic stress overload and we don't even know it, I would be very curious to hear what your thoughts were about education and health if we were to address more of the neuroscience-based approaches to stress resilience and give those more broadly, particularly to those most in need and most disadvantaged.
Yeah, I love the question. I'm just like an awful person to ask that question. If spent so much time in a high stress life, and so I'm a seeker rather than a grantor of wisdom in that circumstance. What I would say is this: all of the things that we can do to help us find space, a little diastole, in our lives as we move forward, I think those are really important things, and important to continue to accentuate them. So I was always a supporter of whatever mechanisms people could use to move forward for our students, for our faculty, for our staff. I began a sabbatical a couple of months ago, and I woke up about a week and a half after the beginning, and I woke up and it was light outside, and I forgot what that felt like. And I think we really get ourselves wound into this thing where our norm is just that norm. And I don't know how we get off the conveyor belt while we're still on it. But I think that we have to be thoughtful as we're on the conveyor belt to remember that doing our best to take care of ourselves is critically important. And I think it's just those continual reminders that I think are a good thing. But I was a massive failure and trying to learn better as we go forward.
Is there another?
Hi, I'm Caroline Fichtenberg. I'm one of the co-directors of the Social Interventions Research and Evaluation Network that's part of the CHC. And I want to ask you a question about what's happening with higher education in this country right now with the federal administration. What are your thoughts about how universities should be responding to the way the administration is using the threats of removing federal funding in a variety of ways to change how, universities' values and how they operate, and to give up control, especially given the role that universities play in, I think, signaling what the values of the best values that our country can have. And I'm just curious, I think it's a very, very hard place to put universities in, to have to choose between, financial security and what they stand for. And I'm just curious how you advise universities to navigate that.
Great question. I wish, magically I could give you a perfect answer. Let me move back to something I said, a couple of things I said before. One, I believe that it's important to be honest and authentic, to tell the truth, to know what's important to you and why, and to try to use that as a guiding principle in the decisions that you're making, the small ones and large ones. So I'd say that's true first. Second, I think that health is a good thing. People being healthy is a good thing. Living a productive, healthy life is a good thing. And that education and better education has really made a difference in our ability as humans to live better, healthier lives. And when we see educational opportunities diminish, then we regress to where we were before we had the opportunity. So I think that health is important, and I think then education is important. And so we need to continue to focus on that. And then I also, at the end of this talk, I mentioned I think it's important to really bring your authentic self to the things that you do, to really bring your best authentic self to the things you do. I think that's critical. And I think it's important to think about the eulogy values, compassion and kindness and grace and all of those things in the world. And then if you apply those to your decision making, I think it helps you to make the right decisions, whatever the venue or subject.
We have another comment and question from our online audience. Hi, Dr. Drake. My name is Lucy Agbu-Nwobodo, and in addition to being a faculty member with DPBS, I'm the director of the UCSF Post-Baccalaureate program, the program that you started almost 27 years ago with Valerie Margol. Firstly, I wanted to thank you for your far-reaching legacy across so many domains, and to let you know that the program continues to be a great success, with over 94% of our students matriculating to medical school. A question: any words of encouragement you have for our trainees and young people who are entering into health professional careers and are feeling demoralized by the current climate we have now in our country and the anti-science and anti-equity rhetoric?
First, thanks for the comments, and thanks for continuing on with this program. I must say a word about the program just for fun. And this is not a plan, so I appreciate the kind comments. I mentioned I was on the admissions committee years ago. This is the Voices from the Past, and it's done by hand a lot, and some students would get accepted, but some would get rejected. And they had a little thing that I would do, is that if you were a faculty or alumni child of a faculty or alumnus, and you were getting rejected, I wrote a little extra on your rejection letter. So it said, "We're sorry we can't admit you, blah, 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 blah. But at the end of the season, if you've not been admitted any place, call me and come by in the summer and we can talk about your application." And most people who applied to us were accepted somewhere by the end of the season, so it didn't happen. But every summer, 2, 3, 4 people would come by and say, "Gosh, I got this letter, and what can you tell me about my options to go to medical school?" And I'd look at the applications, and I could say, "Well, here's where you're a little weak, here's where you're strong, here's what you might do," boom. And over the years, I'd then get a postcard, "Hey, great, I got accepted to medical school," boom, over and over again. It worked quite amazingly well. After 3 or 4 years of this, I thought, great, but these are all faculty or alumni kids. Their parents are all medical doctors. And what about the kids whose parents aren't medical doctors already? The same advice would work for them, but they don't have anybody to call up and say, "Can I come by and see you?" And so we really started the post-bac program with that in mind, to be able to look at students from less advantaged backgrounds, to say, could we have a class on the same things, I would say, to these individuals, to kind of help you move things forward. And so with Valerie Margol and others, and a grant from the state, we began a program here and then spread to other campuses around the system. And I hadn't heard, but you just said it was 94% of the students who went through the program were accepted to medical school. I hadn't heard that. I'm going to give applause to that. That's great. And it shows that advice and support can really help people as they move forward. The advice, what I'd say now for our students is that, start where you are, use what you have, do what you can. There are great things that each one of us, each one of you can do every day with a student or a patient or a colleague to try to have good interactions one after another. And in this time of great stress, the worst thing to do is to kind of let despair freeze you into inaction. Remember the great training you have, the great ability you have, the great connections you have, the great opportunity you have to make a difference, one by one, person by person, day by day. There'll be within that opportunities to reach out and bond with others and to move the needle in a big way. But most important thing is day by day, do your best, step by step, to continue moving forward, particularly when times are hard. I had dinner with a colleague, old friend, a couple nights ago. Person was a fireman, not one of our medical colleagues. And he's a Christian. He goes to church. He knows the Bible well, better than I know the Bible. And he patted me on the shoulder and he said, Psalm 37. I didn't know what that so I looked it up. And basically, it says that 3,500 years ago, people were having tough times. And when you're having tough times, you move forward. And I think that's what I would say to our students and to our new practitioners.
Well, on that inspiring note, I do have one more question for you, and the final question before we move to the next part of our program. And that is, how did the Rock and Roll Board of Directors come about? Can you share that brief story?
Well, part of it's statute of limitation. I can, I in high school played guitar. I worked at Tower Records. Always liked that, and I began teaching a class when I was at Irvine on music and civil rights and the law, and so I taught that for undergraduates for many years until 2020. I taught it. Irvine taught it in Ohio, and when I began to teach the class, I looked under the bed and I found my old guitar. Well, I thought the kids had sold it or something or pawned it, but pawn is a word for the 20th century, forgive me. But I thought that they'd gotten rid of it. But I just pulled it out after many years and started playing it a little bit again. And I started playing with bands of aged baby boomers who had been successful in life and now could buy good equipment and work with people who knew how to play instruments. And I played with a couple of them in fundraisers. And then when we went to Ohio, I thought I really missed leaving that behind. And the Rock Hall is in Ohio, and I talked with some people and actually joined up with a group of wonderful friends, and we would do half a dozen, 10 gigs a year, always with real professional musicians there and a volume knob, so the real professional musicians. But I played with members of the Jefferson Airplane and other things like that. I played at the Rock and Roll Hall of Fame, so it really was a hobby. And then we were able, you could join the Hall of Fame board if they knew who you were and you would contribute. So I didn't. I overstate that. I mean, but it was I worked with. It was an Ohio-based organization, so I had colleagues and friends who were in leadership positions, and so it was great to work with them on that most worthwhile endeavor. Great.
Well, thank you so
much.
Great
to see everyone. Thank you.
And now it gives me great honor to introduce Julia Adler-Milstein, who will be sharing with us the award winners of the Nancy Adler Research Funds. Julia?
Yeah. Well, it is such an honor to be with you all today, and our family has been so looking forward to this event. My mom would have loved it. She would have loved to have seen all of you and hugged all of you and just asked about your lives. She would have loved the topics today, the talk, and just everything. This is just so embodies, the event that she would have appreciated, the lunch after. Just thank you for everyone who put this together. It really means so much to us, and it's because it would have meant so much to her. I was thinking about some of the themes that have come up today, and just how much they resonate as I think about some of the traits that made my mom so unique. She was incredibly resilient. I mean, really, I can think of just like 2 or 3 times over the course of my entire life where she ever lost her temper. And which is just, as a parent, like truly remarkable. I do not know how she managed that. And really it was only at the end of her life where I remember asking her, like, how do you do it? Like, when things get hard, like how do you manage? And Michael, when you put up the image of the road, she said, I just put one foot in front of the other. And I always think about that, because really it's just, it's all we can do sometimes, right? Is just put one foot in front of the other. It's just taking that one next step. And so I hope for me, it's some of the questions that have come up about how do we be resilient, it's just taking the next step and knowing that eventually, right, that does take us forward. But she also really leaned into joy. And I think she would have told us to just remember and look around and find the sources of joy in your life. And she, well, I don't know, she did this for Sarah. She didn't do it for me, but, she'd just do like spontaneous donut runs and, just the little things, right, that bring you joy in life. And again, today is so joyful. And what I get to do today is, I think, the perfect combination of resilience and joy, because we're giving out money to allow people to do the work that's so meaningful to them. And so that I get to do this today is really special. In the sort of formal setup for the awards, it says that, much of my mom's research explored how social and behavioral determinants get under the skin to shape health and health equity, and how strongly she believed in the importance of transdisciplinary collaboration for scientific advancement, and frequently assembled scholars from different disciplines to ponder complex problems. We're now looking at high schools for Gabby, and actually one of the high schools has an introductory class that all freshmen take on introductory to transdisciplinary science. And I thought how much she would have loved to hear that is happening. And many of you remember her sandbox slide where she sort of talked about interdisciplinary versus transdisciplinary. And so perhaps soon these courses actually will be happening in the sandbox at the elementary school level. Earlier this month, the inaugural awardees of the Nancy Adler Seed Grants presented their research findings at a seminar here held in the Pritzker Building. And the research that was presented was inspiring and just a clear reflection of the rigor and spirit of collaboration that defined her work. And this year we get to continue, and we had an incredibly successful call for proposals with so many outstanding applications. And the 3 awardees today really strengthen research spanning medicine, public health, and social science at UCSF. So 2 of the 3 are here with us today. So as I read the names and their projects, please come up so we can see you and clap for you. And so the first is Dr. Natrina Johnson, who's a postdoc in the Department of Medicine, whose project is From Structure to Symptoms, examining how social determinants drive racial disparities and opioid overdose risk. And the second award is to Dr. Brittany Bryant, who is an assistant professor in the Department of Psychiatry and Behavioral Sciences, whose project is Untangling Pseudo-Addiction and Provider Bias in Sickle Cell Disease, Behavioral and Social Determinants of Pain Management Inequities. And last but not least is Dr. Sharad Wadhwani, who's an assistant professor in the Department of Pediatrics with the project Pilot Testing the Health Advocate for Children Undergoing Liver Transplantation, Type 1 Hybrid Effectiveness Implementation, RCT. One quick picture.
Well, that officially concludes this lecture. It was amazing. Thank you guys for being here. But it continues up on the 4th floor terrace for a reception. So I hope all of you can join us. I know Nancy would love all of us to be able to have community and celebrate this day. And so thank you so much. And I'm really excited to start planning for next year. Thank you.